Welcome to Sky Women. I'm your host, Dr. Carolyn Moyers, a wife, mom, and board-certified OB-GYN. This is a place to educate, empower, and inspire. Join us each week as we share the power of women's stories. Real women, real stories, real inspiration. Put on your stretchy pants. Let's get going. Welcome, Sky community, to another episode of Sky Women. I'm so excited for you to join us for the podcast today. Our guest is Dr. Steffi Campbell. She is a board-certified dermatologist and dermatologic surgeon. She's the founder and CEO of Derm in a Box, a skincare company to help you feel confident in your skin with curated, high-quality skincare specifically to use during pregnancy and nursing. So this is right up our alley, as at Sky Women's Health, we specialize in reducing back pain and pelvic pain in pregnancy and postpartum. So this is our jam. Like, how do we feel beautiful? How do we transition through this metamorphosis of pregnancy with some grace? So welcome, Dr. Campbell.
Thank you so much for having me, Dr. Moyer.
So tell us a little bit just about choosing dermatology to begin with. Let's just start from the beginning.
Sure. I fell in love with dermatology, and I knew that that was something that I wanted to pursue. So I went after it, and I actually struggled to get into a dermatology residency, and I actually ended up applying for the second time. But I knew that that was what I wanted to do. So I persisted, and I studied, and I worked really hard, and finally got into dermatology residency and passed my board certification and have been practicing for a couple of years, and it's been really good.
That's awesome. So you persisted even though you didn't get in your first time around. So what did you do for that year after med school?
Well, I did my internship in family medicine, and I actually knew that it wasn't something that I wanted to do for a long run. So when I actually, during internship, I wasn't sure what I wanted to do. So I left that year, and I actually did a year of like a preceptorship with a dermatologist. And I learned all sorts of things from medical dermatology to cosmetics. Even we did Mohs surgery and even like hair transplant and liposuction. And it was like basically a year of basically like a crash course residency program. And I applied to residency in dermatology. I didn't get it. And I completed 2 years in family medicine, and I applied again, and I got into a program after that.
Wow. So you kind of had a well-rounded training with doing a couple of years of family medicine and then derm. Yeah, that's awesome. Okay. So you are a mom of two. Is that right?
Yep. 2 little ones.
Okay. And you had your first baby in residency?
I did. I had both of them in residency back to back. They were 15 months apart, one in my second year, one in my third year.
And that is challenging in of itself, but they always say there's no good time to have babies. It's whenever you're ready, right? So I always promote mamas in medicine to go for it whenever they feel ready. So you started making your own products when you were pregnant, right? Because you were wanting skincare?
Yeah. So I actually had the idea to come up with a pregnancy skincare line, because when I was pregnant, I struggled to find a skincare brand that was made just for pregnancy. And actually, a whole bunch of my colleagues were pregnant around the same time, and they would message me about any skincare tips and what to use and what brand that I would recommend for them. And one of my pediatrician friends actually said that she went to Sephora and asked the lady for a good skincare brand for her while she was pregnant, and they said they didn't have any. So she messaged me and she said, what can I use for my acne? What can I use for my hyperpigmentation? So I started to just curate some boxes for a bunch of my friends, and then it kind of grew into this thing. And I would put like 4 or 5 different skincare lines or skincare products in each box, and just came out to be something that they really enjoyed. And I found so much joy in creating something special for them. And so I just wanted to, so I turned that into something that I can extend to not just my friends who are doctors who are pregnant.
That's awesome. So it came out of your own need and then friends kind of seeking advice. So it's happening organically, but I love that you are like, hey, yeah, this is a skill set that I have. This is my expertise. This can be a business.
Yeah, definitely. And it just is something that I just found so much joy in doing. And I had actually found my why in doing this because as I was creating these boxes, it was so meaningful for me to help
Mhm.
them.
Yeah, that's awesome. Because the skincare industry it's overwhelming. Like there's so many products. I go on dermstore.com and I'm like searching through all the products and
Mhm.
I mean, $300 to $400 later, I've got two serums in my basket, and I don't even know
Exactly.
what I need. Like you've
Yeah.
got 20 or more options of just sunscreen alone. Like it's just so overwhelming. So I love that you are simplifying and curating this specifically for pregnant and postpartum mamas, specifically nursing moms, would you say? Yeah.
Yeah, I mean, for pregnant and nursing moms. So I just wanted to be a guide. Really, initially, just started very organically. I just wanted to be a guide for my friends who were pregnant, and so I would pick out different ingredients and pick out different products for them. So this just came very naturally.
So there is nothing like this on the market?
So there are definitely lots of pregnancy skincare lines on the market, but I think that our company is differentiated because I personally look at every single ingredient. I comb through everything and I produce our products in a very, I guess, picky way so that nothing is in the products that are going to be harmful, especially in a sensitive population like pregnancy and nursing moms.
Right, right. Okay. So tell us about your products. Like how would you present that to us?
Okay, so because I started this as a guide for my pregnant doctor friends. I presented it to them in a way where they can have a regimen because they always ask me, like, well, how do I use this? And how many times a day do I use it? Do I use one in the morning, one at night, both? And they always ask me, which one do I apply first? Do I apply the serum before, the cream, or which one? And I mean, almost every single one of my friends asked me that question. So I created the skincare line. Our skincare line is called Pregnant Glow MD, and it's presented in a regimen. So you get to pick 4 different regimens. And I write it out in a regimen format. Like number one, you use a cleanser, number two, and number three, number four. So is all laid out. And so there's no questions of what you should use first, how you can layer your skincare products on.
So their curated box comes with the instructions for use. So there's no guesswork.
Exactly.
Love it. Okay. So let's talk about your go-to skincare regimen.
Okay. So I actually have the box here if you'd like to check it out.
Let's
I
see
bought it here
it.
just for you.
Derm in a box.
Yep.
Pregnant
Um,
glow.
yep. So Pregnant Glow, I'm really excited because this week we're launching our brand new pregnancy skincare product, Pregnant Glow. And it comes in this beautiful box.
With the pink
There are
tissue paper. I love it.
yeah, there are 8 different products. Each individual product can be purchased separately, but like I mentioned to you before, with the regimen, I just feel like that's really the go-to benefit of having more than one, and it's also discounted a bundle. So we have 4 different packages. We have Sun Safe Mama, which includes all the SPF ingredients. It has the sunscreen. It has the sunscreen powder on the go, which is amazing, and it has an eye cream that is used in the morning that hides your dark under eye circles and has SPF as well because you need the protection under your eyes as well. So that's one regimen. The other regimen is called Minimalist Mama. I'll just actually pull them out and show you. So you can see that. That is our eye cream that has SPF of 50. And then we have our Solar Shield, which has an SPF of 44. Can you see that?
Mm-hmm.
I have a glare.
Yeah.
And it is tinted. So it has iron oxide, which actually protects against blue light too. So it's broad spectrum, has zinc oxide. So that's great to use. And then our sunscreen powder is also SPF 50. It's a mineral sunscreen.
Love it.
It's great to use because most people don't forget to use their sunscreen in the morning, maybe, but we often forget to apply it during the daytime when we're out walking around. And, we think like, oh, I'm just going to run outside for like 5 or 10 minutes. And then it turns out to be an hour. And then you have makeup, sometimes you have makeup over and you don't feel like putting like a cream on top of it. So I love the sunscreen powders. So that's our Minimalist Mama regimen has our cleanser. It's our age-defying antioxidant cleanser. And it does foam up a little bit, has green tea and a bunch of other natural antioxidants. And so that includes the cleanser, the antioxidant serum. Can you see that?
Yes.
Okay, that is our concentrated vitamin C serum. It's helpful for wrinkles. It brightens your complexion. It also strengthens the microbiome. Has protective effects too. And then our collagen recharge. So this is a moisturizer that has collagen in it. And I love to just use this as a moisturizer itself.
Right.
So I mentioned there's 4 different packages. Basically our shebang, this is like all of it I call it the red carpet mama.
Okay.
You have Minimalist Mama, you have Pampered Mama, which is like the middle regimen. I didn't show you this one. This one is our hyaluronic acid serum.
Okay. Awesome.
And lastly, our pregnant glow serum. So this is really great for melasma in pregnancy or just any kind of hyperpigmentation during pregnancy. That's helpful to use. So yeah. So I went through and I combed through all the ingredients and made sure that everything in here didn't have anything that was harmful. There's no hydroquinone. There's no bleaching creams in here. All the sunscreens mineral based.
Awesome. Yeah. Well, as a mama who has been pregnant 4 times and nursed for years of her life, I can absolutely appreciate having a simple regimen that you can go to, that you can trust. I love the idea of keeping it simple. You can go to the red carpet or you can keep it minimalist. Like you kind of cover the basis for all mamas, depending, because some people are super simple with their skincare regimen. If you make it too messy or too complicated, they're not going to do it. And some people need all the serums.
Yep, exactly. Yeah. And some people do. Like I tend to like, to wear everything, but like some days, you're kind of in a hurry, but I do include the antioxidant serum, which I think is like one of the most important things for pregnant mamas to use. And so this is in every package.
Okay.
Yeah.
So tell us, you mentioned sunscreen, and we all know and have heard that we need to apply our sunscreen every morning. It's the thing you put on before you put on any makeup if you're going to wear it, right? So you cleanse your face, use a moisturizer if you need it, any serums. Actually, why don't you put that in proper order because you're the dermatologist? Your ideal morning regimen would be.
Okay, so what I actually do use these products, even though I'm not pregnant or planning on becoming pregnant. I just add a couple of other ingredients because this is actually really good even after you're pregnant. And so what I do is I cleanse my skin in the morning and I apply my vitamin C serum first. Like sunscreen, I think like that's like the last thing I do before I apply my makeup. So I do the serums first. And then after that, I do the creams. And then after that, I do sunscreen and then makeup.
Yeah. Okay. And so reapplying the makeup, reapplying your sunscreen, whenever we're out at the beach or we're out hiking, we're more likely to reapply our sunscreen, right? But when we're just running to the grocery store or going to work or getting kids out for a play date, we're not thinking about it as much. So I love the fact that you have the powder that you can just brush on.
Yes. And especially in pregnant women, because our skin, you can have really long lasting changes in your skin when you're pregnant. And it can last for many, many years, like melasma, as you know. So I think it's really important just to prevent hyperpigmentation and try to, use the sunscreen as much as you can, because it can stay with you for many years after and can actually be more costly trying to get rid of it afterwards. So I always like to think that prevention is like the best treatment.
Yes. So speaking of melasma, so melasma is that mask of pregnancy, that hyperpigmentation or darkened area that you tend to get along the cheek lines. Is it ever going to go away? Asking for a friend here who wore her sunscreen in her hats. I still have some residual melasma, particularly on one cheek.
I do think that there is hope. It's just that it can present in a mild to moderate to severe. And so, that's why I think like prevention is the best. Although sometimes no matter what you do, you may still end up getting melasma, even if you do all the right stuff. And that's just part of life, part of your hormones, but just trying to, but your question is, there is hope.
So what's your go-to like after mama, has finished nursing and her melasma just hasn't gone away? What's your go-to?
Well, I always like to try the conservative measure first. Typically, I would try a combo of different creams, prescription creams, and also over-the-counter cosmeceuticals. Hydroquinone is one that I do often, actually for my patients, I do often compound medications. And I do that for about 3 months. And I alternate that with over-the-counter skin brighteners such as kojic acid. Sometimes I can compound that. You can compound that with azelaic acid. And there's numerous serums and creams that you can use for hyperpigmentation. And I kind of, I alternate it every 3 months, but also you also may end up needing laser to kind of treat some of those stubborn spots.
Okay. And how many laser treatments typically?
It really varies from person to person and how severe it is and how stubborn the melasma can be. I have seen, sometimes in my patients, maybe 2 treatments, 3 treatments, if it's really pretty mild. Yeah. So it really just depends on individual.
Okay. So you told us about your morning regimen, your preferred morning regimen. What would be your preferred evening regimen?
So my evening regimen currently is I actually do use my vitamin C serum. I do it twice a day. And I do that first after cleansing my skin. And after that, I do have a couple of these little hyperpigmented spots here. So I do like to treat those. And I use my vitamin C and I layer on top of it. I do use some formulation of this, which has kojic acid in it. And that helps. It's a safe ingredient for hyperpigmentation in pregnancy. And I use some formulation of this plus a bleaching cream just for a short period of time. And then I also use my retinol on top of that. And then I use a collagen moisturizer.
Okay. And so the retinol you're using because you're out of the window of pregnancy and nursing. Yeah. But we don't use that in pregnancy and nursing typically.
Yeah. Typically it is avoided in pregnancy. In nursing, so there are studies that retinol can actually be restarted in pregnancy, although I always like to recommend that everyone consult with their physician, their OB, or their dermatologist to see what is the best customized, personalized regimen for them.
Okay, so tell us about what are the big no-nos of skincare in pregnancy that you see?
So the common no-nos are any kind of retinol, vitamin A derivative, like retinol, even tretinoin, retinol, any of the over-the-counter vitamin A. Like usually if you go to the pharmacy or a cosmetic store and you find an anti-aging cream, it typically has vitamin A in it. I don't recommend those in pregnancy. And then the other big no-no is hydroquinone, because that one is a skin lightener, but it has been shown to have absorption in your bloodstream to a higher level than the other one. So those two are like the big no-nos.
Okay. All right. And then what's your opinion on facials or microdermabrasion or anything of that nature in pregnancy?
Okay. So my opinion in facials is that I think it's fine to get facials when you're pregnant. However, so for pregnancy, I usually like to think of any kind of products or procedures that you want to try to reduce the complications, the potential complications. When you're pregnant, your skin is a little bit more sensitive. because if you have any kind of adverse event, whether it's minor or even if it's minor, you may still need treatment. And so I just want to avoid any kind of excess, potential complications there. And so I don't recommend laser or light therapy or any of that, or even like sclerotherapy or anything that involves even Botox or filler. So that can wait until afterwards. But I think facials are pretty non-invasive as long as it doesn't have too many ingredients where it can give you like a contact dermatitis. So if it's just mild facial, I think that should be fine.
Okay. We have got to talk about hair loss in postpartum period. I mean, the hair just starts falling out in the shower. You've got gobs in your hair. You're wondering if you're going to have any hair left when this is all over. It presents around 3-4 months postpartum. What are your thoughts about that? If that's one of your passions, tell me.
Yeah, I mean, I experienced it twice. And, I'm still kind of regrowing some hair, actually. But, the good news is that it does come back. It just, it sucks in the meantime, but it does come back. You can kind of help it along with some treatment. But for me, when I evaluate a patient who's postpartum, has hair loss, I still, you never know there could be, I have found some underlying nutritional deficiencies. So I still do a workup just in case there's anything else that could be missing. But there is definitely hope. It just takes time, a lot of time sometimes, and patience, really.
Yeah. So I've noticed, because I've gone through it multiple times. So I have noticed that usually between 6 and 12 months, I'm seeing a recurrence, but I read it can take up to 15 months for the hair growth to return.
Yeah, it can take even longer than that just to see like meaningful like cosmetic results. Like for you to just notice like, wow, my hair is fuller and thicker. And when I put my hair up in a ponytail, it's like a lot thicker. But I have little baby hairs here right now. That's coming in.
Yeah. And your youngest is how old?
He is 2.
2. Okay. Yeah. So you're still in that period. You know what it's like.
Well, yeah, I definitely did have hair growth. And then I think I actually had pandemic, like telogen and effluvium.
Uh-huh.
So now it's kind of growing back in. Like you can see that. You see that little?
Yeah. Little wispy. And so this just launched. Your products went live as of today, right, on the website.
Yeah.
Tell everyone where they can find you.
You can find us at derminabox.co. We're also on social media on Facebook, Instagram, and Pinterest.
Okay. Awesome. And same Derminabox?
Derminabox.
Okay. Awesome. Fantastic. This is exciting. It's so nice to just have simplified skincare regimen specifically for our pregnant and nursing mamas.
Thank you so much for having me.
All right, Sky community, thank you for listening to another episode. This episode was sponsored by Sky Women's Health. As a reminder, we're in the Dallas-Fort Worth area, and we help relieve back pain and pelvic pain in pregnancy and beyond. If you are pregnant and having pain and you feel like you have no reliable way to relieve it, look us up at skywomenshealth.com, request an appointment, and we'll call to get you scheduled. As a board-certified OB-GYN with a neuromusculoskeletal medicine fellowship, I help you realign with hands-on drug-free treatment and relieve pain on the spot without medication. We'll help you maintain these results through your pregnancy and postpartum period. Every pregnant person deserves this, and we are so excited to serve you. You can find us on our website, as mentioned, or on social at Sky Women's Health, or you can call the office at 817-915-9803. That's it for today. Until next week, be well.